On the occasion of World Hypertension Day, my greetings to all of you. Hypertension is a very important disorder that we physicians see in our day-to-day practice, and it is extremely important for the patient as well to understand what is hypertension and how to manage it. When it comes to hypertension, it is an octet, and we generally call it as 8S, which are that they are more common in male sex. It's more common in those patients who are sedentary, those who take excessive salt, those who take excessive sugar, those who do not get adequate sleep, those who are sedentary in their lifestyle, and those who are under stressful conditions all the time. Having said that, my major concern about hypertension is the fact that 50% of the patients with blood pressure or hypertension do not have any symptoms. So you would be seeing many people in your own home or your neighbors with high blood pressure, and they themselves not knowing the fact that they have hypertension. And why is it important to know that you need to treat hypertension to know about it? Hypertension is a silent killer. If blood pressure or hypertension is not under good control, it can lead to various consequences which are entirely unpleasant. These consequences could be that you may have a brain stroke, brain hemorrhage, leading to paralysis, coma, and death. It can also lead to some detachment of the retina, visual disturbances. As far as the heart is concerned, the commonest cause for heart attack or a common predisposing factor or the greatest risk for heart attack is hypertension. And therefore, if the blood pressure is uncontrolled, it leads to enlargement of the heart, and that can cause breathlessness with minimal effort. Lower down, blood pressure is also known to affect the kidneys adversely. And it is important for patients with blood pressure to understand that the kidneys themselves can cause hypertension, and hypertension can also lead to deterioration of the kidney function. Hypertension can also lead to bleeding from the nose. So in short, hypertension is a chronic disease which has no cure. You can only control it. And the best way to control hypertension is to change your lifestyle for the better, which means have at least 7 hours of good sleep at night. Make sure that your stress levels are low by having a very positive attitude towards life. Do de-stressing by having periodic vacations. Have yoga, meditation, play some music, or have some hobbies which you can carry on for a very long period of time. Number 2 is reduce your salt intake to less than 5 grams per day. Avoid sugar as far as is possible. Make sure that you have homemade food with lot of millets and less of carbohydrates. And make sure that you're physically active.